Hi guys, welcome to another episode of 21 Questions with Dr. Awua. My name is Dr. Awua, your favorite dentist. In the last episode, we had Abna send us a message talking about means and ways to take care of your mouth, whether you have to brush before eating or you need to eat before you brush. And we dealt with that. Today we have a new question. Before we get into it, I would like to thank my sponsors, Delicious. They are the makers of these water flossers. If you've not got a water flosser now, what are you waiting for? They are my proud sponsors. They got me this beautiful water flosser, and they also provide tongue scrapers. So guys, if you need any shop to get your oral care products, contact Delicious. I'll drop their Instagram handle in the description box of this video. Right. So guys, let's get into it. Dear Dr. Awua, I'm writing to you with a delicate matter that's been causing a lot of stress in my life. My boyfriend and I have been together for a while now, and our relationship has been wonderful. However, there's one issue that's starting to strain our connection: his bad breath. I know this might sound superficial, but it's becoming a real problem. It's not just about the physical discomfort, it's also affecting our intimacy and overall happiness. I've tried to hint at it delicately, but I'm afraid I haven't been successful. I'm hoping you might have some advice on how to approach this sensitive topic with him, perhaps suggest some oral hygiene tips that could help. I'm really worried that if we don't address this soon, it could damage our relationship. Thank you for your time and understanding. Sure. This is a pretty tough question. This is a really, really tough question. I know some of you might have experienced bad breath one way or the other. Either you may be the person receiving the bad breath, or you may be the person giving out the bad breath. It could be in so many forms. And I'm glad she's been able to reach out to me. It's a sensitive topic. We need to be quite open, and I'll try to answer this as honestly as possible. Very tough one. Very, very, very tough one. So as most of you may know, bad breath, also known as halitosis, chronic bad breath, it's classified into three main groups. We have the real or genuine halitosis, meaning there's actually halitosis. We have the pseudo halitosis, and we have the halitophobia. So when you talk about the real or genuine halitosis, there's actually halitosis, there's actually bad breath. The bad breath is actually there. And even with that one, it's subcategorized into the physiologic and the pathologic. I'll explain that later. The other type of bad breath is the pseudo halitosis, meaning such people have been treated for halitosis or bad breath in the past. Maybe they went to see their dentist, they did some treatments for them, and they're fine. But such people still perceive that they still have bad breath. That's a group of people who perceive that they have bad breath, even though they've been treated for bad breath and it's no longer there. The third group of halitosis is the halitophobia. These people, they don't have bad breath, but they feel that actually the bad breath is. Yeah, we categorize those people into halitophobia. Those people are quite difficult to treat because there's no bad breath. It's similar to the pseudohalitosis, but with the halitophobia, they've never experienced bad breath before, but it's ingrained in their head that they have halitophobia. So those people be brushing their teeth vigorously in the morning. It becomes like a compulsive, obsessive compulsive thing. They can even brush their teeth like 10 times in a day because Charlie, then they fear bad breath. They don't want to be noted for bad breath. So they are constantly using mouthwash, brushing the tongue, and then they'll be gagging, vomiting. No. Those people, halitophobia, like they don't even want to have any case with a halitosis or bad breath. So let me start with the first category. That's the real or genuine halitosis. So the physiologic halitosis, it's natural. All of us, when we wake up in the morning and we open our mouths to talk, sometimes there's some small dragon breath. That is normal, absolutely normal. Because if you've closed your mouth for a long period of time, for 6 to 8 hours, there's no active movement of saliva in your mouth to lubricate your mouth, and also you're prone to a dry mouth during sleep. So when you wake up, it's natural that you have bad breath. But those whose own can be quite bad is those who don't even brush the night before and they sleep and then they wake up in the morning and start talking. Charlie, it can be quite pungent sometimes. So the physiologic one, it's normal. You wake up in the morning, that morning halitosis, it's normal. We have another group called the pathologic. So the pathologic, there's an apparent problem, something D, you understand? Something D that's causing the bad breath. And even with that one, it's subcategorized into the oral type and the extra oral. When I say oral, it's coming from the mouth. The causes are from the mouth. When I say extra oral, meaning it's coming outside the mouth. So let's talk about causes within the mouth. You can have a dirty tongue or a tongue coating. You don't brush your tongue often. You can have bad breath emanating from your mouth. When we talk about gum disease, if you have any form of gingivitis, you're also prone to bad breath. If you have any form of pericoronitis, when I talk about pericoronitis, I'm referring to the gum that covers the wisdom tooth and then food packs under the gum. We call it pericoronitis. Ideally, you're supposed to have your wisdom tooth between the ages of 18 to 22 years. Once you're above that age, if the wisdom tooth is not positioned properly, you're going to have food packing under the gum covering the wisdom tooth, and that can cause an infection of the gum there. That's also another form of bad breath. Tooth decay. You have a hole in your tooth. Food keeps packing in the hole. The germs from the saliva ferment the food in the hole, and it causes a lot of bad breath. And those who don't visit the dentist often, you end up having plaque and tartar all over your teeth, especially behind your lower front teeth. Let me show you. So behind this area, you end up accumulating a lot of plaque and tartar. And even at the front parts, you end up accumulating a lot of plaque and tartar. And when that happens, you are prone to bad breath. The extraoral causes could be tonsillitis. You have these structures at the back of your throat. Sometimes when they get inflamed, they are predisposed to bad breath. People with chronic sinusitis, there are these cavities on the left and right sides of your nose. They are responsible for giving echo and help to give balance to you when you're talking, when you're walking. You have these cavities on the left and right sides of your nose within the bone. Whenever they get blocked or infected, also predisposed to bad breath. Any nasal blockage, anything that blocks your nose, can predispose you to bad breath. People with chronic kidney disease, people with diabetes, people with lung cancer, liver cancer, gastric ulcer, all these people are predisposed to bad breath. Other causes of bad breath could be side effects of certain medications. Certain medications that you take can also predispose you to bad breath. Another cause could be dry mouth. For every human being, when your mouth is dry, you're predisposed to bad breath, because saliva plays an important role in our mouth. It helps to lubricate our mouths. And if you're the type who doesn't hydrate your mouth often, you're predisposed to bad breath. So the other cause, as I told you about, there's halitosis. Those people have been treated for bad breath before, but even after that, they still perceive that they have bad breath. The other cause is the halitophobia. Those who have not had bad breath before, but Charlie, they feel that the bad breath is still there. They feel that the bad breath is still there. Let's talk about the strategies that you can use to encourage your boyfriend to visit the dentist for us to assess, to see what the problem is. It's not advisable that you go and buy. Some people will go and buy toothpaste, toothbrush, and mouthwash and give to them that use. Sometimes it doesn't come out well. He or she may be offended. So we're going to talk about strategies that you can use to encourage your boyfriend to see the dentist. First of all, you need to choose the right time and place. You can't just blurt it out in public. You're in public transport, or with some people, group of friends, and you say that, but could you Charlie, that bad breath, no. You need to choose the right time and the right place. Pick a time or a place where it's calm, a quiet, private setting. That's when you can have a conversation that is less stressful. You need to be honest and direct. You should avoid blaming or shaming the person. Be clear about your concerns. Don't try to let it seem as if it's having an impact on just him, but let it be known that it's having an impact on both you and him. And This could be a very honest and direct conversation. The third should be that you should frame this positively. Emphasize the benefits of having a good oral hygiene, the fact that it can improve your confidence, improve your oral health. The dentist can help him achieve these goals if he's able to visit the dentist. You should also offer support and encouragement. You should offer to accompany him to the dentist. Don't just send him off to the dentist. No, try as much as possible to offer some form of company. You know, he'll be quite nervous or anxious, especially if he has never been to the dentist before. Try to be patient and understanding. I know it takes some time to change. Change takes time. You can't just force him that today you're speaking to him, you expect him to follow through immediately. No. Keep the lines of communication open so that he can have the confidence to go see the dentist. Give him some gentle reminders from time to time. And also scheduling the appointment together with him so you can go together with him so that the experience can be less intimidating. Yes. And it will make him feel more comfortable. Remember, the key is the approach, how you approach the conversation. I hope you're able to encourage him to see the dentist and have his mouth checked to see what type of bad breath he has. As I said, there are different categories of bad breath. You don't have one treatment that can encompass all the types of bad breath. Every type of bad breath has its treatment. If it's plaque and tartar, gingivitis, tongue coatings, we know how to address that at the dental clinic. And in case you want to visit my clinic, I'll drop the link in the description box. You can give me a call. You can schedule an appointment. Come, let's check your teeth for you and let's take it over from there. Thank you for watching. Please try to check out my next video. Peace. See you on the flip side.